Bismillahirrahmanirrahim. So starting from where we left, SK Gynae Pink MCQ number 85. So the human placenta has option A, B, C and D. Option A is covered with amnion on its fetal side. That is the right option. Option B is chorioelentic placenta. No, it is a hemochoroidal placenta. Get separated along the stratum spongiosum? Yes. Get separated when there is a rupture of many uterine arteries? Yes. So it may be a poor recall. So the question may be human placenta has all of the following except, or the question is all are correct except, or the question is which of the following is incorrect. So option B is the right option. Coming towards some of the reason why. Now focus on this diagram. This is the fetal side, this is the maternal side. On the fetal side, this is amnion layer. So it has, the placenta has a fetal side that is covered with amnion. That option is right. Again, you see, this is the fetal surface and that is covered with, here it is mentioned, top, amnion. This is the maternal surface, and these small bumps, these are called cotyledons, and these are actually the portion of decidua or uterus. So that option was right, that the fetal surface is covered with amnion. The other option was that it separates through spongiosum. That is also right. Focus on this. The outer portion of the spongy layer, the separation of the placenta occurs in the outer portion of the spongy layer of the decidua basilis, outer portion of the spongy layer of the decidua basilis. That is also right. So the option which was which mostly fat or in that scenario is mostly it is the stem is wrong. So you have to clear your concept regarding that. Now this is the reason or the proof for the third. This is actually in the human there is hemochoroidal placenta. This is a hemochoroidal placenta. So out of the 4 options, I proved that the 3 are right, and I proved that the 1 is wrong. So most probably the stem is wrong. So you have to focus on the stem. You have to clear your concept. So for me, it's option B and change the stem. It's option B and change the stem. Coming toward the next, which type of data if between presence and absence of vomiting? So this is a straightforward question. This is a nominal data. Name is mentioned. If there was some order, then that was supposed to be ordinal, but this is nominal data. Just totalize it. What is the common cause of hepatocellular carcinoma in developing countries? Again, the straightforward MCQ, and this is hepatitis B and C in developing countries. But if the question asks in developed countries, that is alcohol. Coming next, feco-oral route of hepatitis is vowel heads the bowel, A and E. Over here it's E. Coming next, what is the median of values are 20, 20, 25, 30, 35, 40. Median mean the middle number. So if you are having odd number, like for example 3, the middle is this one, 5, the middle is this one. But if you are having even number, like suppose 6 number, then which number is the middle number? Here there are 1, 2, 3, 4, 5, 6 number. So which number is the middle number? So what you do, you take out the 2 middle number. 1, 2. So what are the 2 middle number? 1, 2, the third and fourth. You take those 2 number, you add them and divide by 2. So that is a simple formula. and the answer over here will be, so you take 25 and 30, add them and divide by 2, whatever is the answer, you have to pick that. And of course I think there is 27.5. Now prevalence is defined as simple MCQ, all cases, new and old, while the incidence is defined as new cases. Now the adult polycystic kidney disease is autosomal dominant, while the infant polycystic kidney disease is the neonatal, that is autosomal recessive, but this one is dominant. Most bioavailability of which drug? So this is metoclopramide, that is right, because it has decreased first fast metabolism as compared to the other. While which one among them is having lowest bioavailability? That is loperamide, that has got extensive first fast metabolism. Recurrent infection in the elderly, that is always obstructive, the BPH. If the BPH is missing, the next option you have to pick is the obstruction to the urinary tract. Obstruction to the urinary tract is the right answer. Now the next MCQ is osmolol. So in renal failure, the elimination rate is decreased and the toxic metabolite they accumulate in the body, and which can cause toxicity. So the option B is right. Now cancer is least related to traumatic injury. It is related to age, it is related to hereditary, it is related to the sunlight, skin cancer. It is related to the virus, Epstein-Barr virus, Burkitt lymphoma. But traumatic injury decreased. Now coming toward this MCQ 96, the sacroiliac joint, I already discussed in details in my first video, that, and this MCQ over here now proved what I told over there. I told that the stem is wrong and the actual stem may be, which of the following is incorrect. So it is plain synovial joint, that is correct. This is sacral surface is covered with hyaline cartilage, that is correct. Iliac surface is covered with fibrous cartilage, that is also correct. So the correct option over here is missing. So you go to my first video and watch it from there. I discussed this in detail. So this is plain synovial joint, but other options are also correct. Resting membrane potential is achieved by potassium efflux, the opening of potassium channel and the movement of potassium from inside the cell to the outside the cell, while resting membrane potential is maintained by sodium potassium ATPase. Straightforward. Coming toward this MCQ, that is a man with A blood group, A positive, causes reaction when transfused with. So clear cut MCQ, and there is a video regarding the blood transfusion reaction on my page, YouTube page. You can watch it from there. Universal donor of RBC, universal donor of plasma, universal recipient of RBC, universal recipient of plasma. You can watch it from there. Here option is right, option C. About left renal gland, that is the correct answer. Left renal vein drains into the inferior vena cava. Right goes directly. Now focus on this MCQ, and they have they want to check your concept regarding this. A woman came with the jaundice. Now whenever a patient is having jaundice, how much bilirubin do you expect? That is more than 2.5, while some book says more than 3. So if a patient comes to you with jaundice, think of bilirubin more than 3. So a patient is also having fever and HB is 6. Now there is decreased HB and there is increased bilirubin, but they have given you a direct bilirubin, that is 0.9. So it means that major portion of the bilirubin is indirect, because the direct is less. If you do simple maths, let's suppose 3 minus 0.9, that 3 minus 1, that gives you 2. So it means 1 is the direct or conjugated, but 2 is unconjugated. So it means the major problem is the unconjugated hyperbilirubinemia. So if your indirect bilirubin goes up, the HB goes down. HB goes down, indirect bilirubin goes up. This is hemolytic anemia. This is hemolytic anemia. This is not biliary stone. Biliary stone will give you obstructive jaundice, in which the conjugated bilirubin will be high. Basic tissue of the body is all except. Now you have to look in exam, if there is another tissue in the exam you have to pick that, but out of these options I will pick the blood, because the three tissues, they are the major categories, while the fourth one, that is connective tissue, that is missing. The blood is then further classification of the connective tissue, so that is least likely, but you have to keep in mind, if there is another option in exam you have to pick that, but if that is missing then choose the blood. Now this is very important. 4 ml solution contain 2% lidocaine. How much concentration of substance is present in a solution? Now 2% mean what? 2% mean 2 gram by 100 ml, or we can write 2 gram as 2000 milligram divided by 100, because 1 gram is equal to 1000 milligram, so 2 gram will be equal to 2000 milligram. So Sipper is cancelled with Sipper is cancelled with 0, so it means 1 ml is having 20 milligram. Now the question is very simple. 1 ml is 20 milligram and they are asking about 4 ml. So 4 ml will be how much? So 20 multiplied by 4, that gave you 80 milligram. Simple mathematics, don't confuse yourself. The key is right. So 103 is a statement. Haemophilus ducreyi is gram negative bacteria that cause chancroid. So 104 MCQ regarding bar bodies, which is incorrect. I already discussed, made a video on that. That is which is incorrect, that is are completely inactive, because it is not completely inactive, and I have given a reference from the MRCOG part 1st MCQs, and there they have mentioned that the portion of this chromosome is active, so that is the option A is the right answer over here. So about cranial nerve 3, so it has got superior and inferior rami that passes through superior and inferior orbital pressure. That is the wrong answer, because both the rami, the superior and inferior, they pass through the superior orbital pressure. They does not pass through the inferior orbital pressure, so that is out. Start from the trigeminal ganglion, that is also wrong, because it starts from the superior colliculus, brainstem. So by exclusion criteria, option C is right. Up to the ciliary muscle, you are having parasympathetic fiber that helps in accommodation. So grab the concept. Oxygen content decreases by decreased hemoglobin. Now they can confuse you. What is the effect of oxygen saturation if the HB falls? Nothing. The saturation is normal, it is oxygen content that decreases. Why? Because the saturation means, if the saturation is 97%, it means all the hemoglobin that is coming through the blood vessel that is saturated, that is having oxygen. So if you are having 8, HB of 8, and all are having oxygen, so it means 97% saturation. So keep in mind, oxygen content and oxygen saturation are two different things. Now coming toward another, this is FiO2, and I have made another video on FiO2, concept of FiO2. So which FiO2 does not cause retrolental fibroplasia in fetus? Now this is actually occur in premature infants, that when you give very high oxygen, so what happens? Oxygen causes what? It causes angiogenesis. So if you give very high oxygen, that causes blindness. Now you have to open your mind, because which FiO2 cause retrolental fibroplasia? That is 0.4%. 0.4 FiO2. Which FiO2? 0.4 FiO2, or we can write it in 40%. In percentage, it is 40%. So the upper limit is 40%. So 40% or less than 40% you can give, but above 40% it causes retrolental fibroplasia. Or if they are giving you it in decimal, so in points, so it is 0.4. So over here the correct option is 35. There's actually percentage, 35%. 35% mean less than 40%. Option B is not right because that is 65, that is above 40. Option C is also not right because 0.8 mean 80%, and 80% mean you are giving more oxygen. So 80% is the wrong choice. 0.8 mean 80%, and 1 mean 100%. That is again wrong choice. So the correct answer over here is option A. Patient got diphtheria and you give toxide 2 weeks back, now develop urticaria. Whenever you give toxide, think of type 3 hypersensitivity reaction. Think of type 3 hypersensitivity reaction. It is not anaphylaxis. Anaphylaxis is type 1 hypersensitivity reaction. So it is type 3. The key is right, option C. Now the anion gap, it is the difference between unmeasured anion and the unmeasured cation, and reference is the Guyton. Reference is the Guyton. Don't confuse yourself there. I will make another complete video about the anion gap, but right now you can trust me that it is actually a difference between unmeasured anion and unmeasured cation. It is not the difference between measured cation and measured anion. Reference is Guyton, and right now you have to quickly utilize it. Now if you are going into the detail of that MCQ, you are wasting your time. I will make video on that. You can clearly watch it after that. Now next MCQ 8, that is the middle part of the optic chiasma, or the central part of the optic chiasma. Now there is another MCQ. They gave you pituitary gland, but they gave you what? They gave you binasal hemianopia, not bitemporal. So they are actually confusing you. You are having this side fibers. There is another complete video, but right now you have to trust me that this is the middle part of the optic chiasma or the central part of the optic chiasma. But they will actually confuse you. They will give you pituitary gland, and they will give you another scenario like right homonymous hemianopia. Now the pituitary gland tumor does not cause right homonymous hemianopia or the left homonymous hemianopia. So just not be preoccupied with these options. Focus, open your mind. Now the forceful stretching, the Golgi tendon, inhibitory, so it causes relaxation. There is also the deep tendon reflexes mechanism. The coenzyme in fatty acid metabolism is biotin, just utilize it, no concept. For the carbohydrate, that is thymine, and for the proteins, that is pyridoxine or vitamin B6. Coming forward, carbon carrying coenzyme in oxidation, that is biotin, clear cut MCQ. If the biotin is missing, then the tetrahydrofolate is the right option. Tetrahydrofolate. So coming forward, the S1 compression causes what? They are talking about the S1 narrow root. So the L4 causes what? L5 causes what? And S1 causes what? These are frequently asked questions. The L4 causes what? Decrease extension at the knee joint. So there is weakening of the knee joint reflex. L5 causes what? Decreased sensation over the dorsum of the foot. In MCQ, they will give you just one clue, and if you miss that one clue, you are losing the marks. So the L5 causes the sensation over the dorsum of the foot, and also causes the inversion and the eversion, the L5. So loss of inversion, loss of eversion, and tingling sensation on the dorsum of the foot, think of L5. S1 causes sensation on the under surface of the foot or the ankle reflex. So if the ankle reflex is missing and there is decreased sensation on the sole of the foot, on the dorsum of the foot, and there is a weak dorsiflexion. S1 causes dorsiflexion, L5 causes plantar flexion, and L5 causes dorsiflexion. So the L5 will cause weakening of the dorsiflexion, S1 will cause the weakening of the plantar flexion, and there will be tingling or decreased sensation on this side and on that side. So over here, the loss of ankle jerk, that is the right answer. Which of the following is true regarding spermatogenesis? Option A is wrong, option B is wrong. It takes 74 days for the spermatogenesis to be completed. The 30 days actually it takes from during the transport to the ejaculatory duct. So the transportation takes the 30 days, 74 days it takes in the formation. So 70 plus 30, that is the total duration of the sperm formation to the delivery to the tubes, ejaculatory duct, that is 90 days, 3 months. But the sperm formation takes how much time? 74 days. So A is out, C is out, B is right. 4 sperm, 1 gave rise to 4 with the haplide nuclei. Question about the onset and duration of, now this is very important, of local anesthetic. Now there is a printing mistake. They have given option A is the action of local anesthetic. The question about the onset and duration of action of local anesthetic. So the answer is B. Onset changes by the change in pH, and there is a reference regarding that. The lignocaine has got more duration of action because of intrinsic vasodilating property. The lignocaine causes vasodilation, so the duration of action is based on that. Do you remember lignocaine has adrenaline in it? Why? Because adrenaline causes vasoconstriction to prolong the duration of action of this local anesthetic. So actually the vasodilating property or the vasoconstricting property, the onset or the duration is affected. So the onset changes by the change in pH. Yes, the onset changes by the change in pH. So the option B is right. Aggregation of lymphoid tissue covered by squamous epithelium, that is a clear-cut MCQ, that is Peloton tonsil. Bupivacaine preferred over bupivacaine less toxic. Option A is right. New bone mass in the line died after 2 hours. Is it after 2 hours or after 2 days? Don't know, there is a printing mistake. But the rule of FCPS part first is that when you do not know the right option, follow the majority. If you are not sure about the right option over here, the majority is following option C, so follow that. In my opinion, a patient is having actually cystic disease, the infant, that is the infant polycystic kidney disease, that is autosomal recessive. So in that condition, there is association of pulmonary hypoplasia. So the person is having high mortality during the first 2 days. But don't know, if anyone is having a reference, can share in the comments below. But and autopsy finding can show cystic masses, that can be the right answer. But if you are not sure, then choose what the majority are picking. For spontaneous vaginal delivery of IUCD baby with hydrocephalus, the needle will be passed in anterior fontanelle or posterior fontanelle. Again, highly controversial MCQ. Do not know about the right answer, but follow the majority. Glucagon increases in exercise. Now the glucagon is increased during exercise. Exercise, there is sympathetic stimulation, and during exercise the glucose enters into the skeletal muscle by the opening of the stretch receptor channels, and the insulin drops, so the glucagon goes up. Coming next, in case of patient multigravida with IUD, intrauterine death and bleeding, what is the immediate treatment? So the answer over here is evacuation. Evacuation. It is not blood transfusion. Treat the cause, because if they were interested in blood transfusion, they would give you the hemodynamics, and they would give you whether it is a massive bleeding. But intrauterine death with bleeding, evacuate. An obese man with atherosclerosis underwent laparotomy due to bleeding and blah blah blah, and there was a purple in his small gut was purple and superior mesenteric vein was okay. What is diagnosis? The answer over here is wet gangrene. Now why it is not red infarct? The reason is, in red infarct there was supposed to be a clot in the mesenteric vein, but there is no clot in the mesenteric vein, so choose the wet gangrene. But if he gave you that the mesenteric vein is having clot, choose the red infarct. Coming next, open wound healing, straightforward question. contraction of myofibroblast, not fibroblast, myofibroblast. Cytochrome P450, the major reaction is hydroxylation, the key is right. Coming next, true about intrinsic pathway. Now the answer over here is collagen exposure or factor 12 activation. If the collagen exposure is missing, then the next option you have to choose factor 12 activation. They are talking about intrinsic pathway. In the extrinsic pathway, the option A is right, the tissue damage and release tissue factor. That is for extrinsic pathway. But the intrinsic pathway, that is collagen exposure. When the blood comes in contact with the collagen, factor 12 is activated. Epidural will give analgesia when the baby was delivered. Which narrow route was spared? S1, S2. S1, S2 is the right answer. Femoral narrow route, that is L3, L4, L5 key is right. Coming down, C-section, artery damage in anterior wall. Now this is again controversy. Some people say uterine artery, while some say inferior epigastric artery. Now I will give you clear-cut concept. If they mention the interior abdominal wall, choose the inferior epigastric artery. But if they ask which artery is damaged more and do not talk about interior abdominal wall, then choose uterine artery. Uterine artery what? When they do not mention about the interior abdominal wall. But when they mention about interior, then option C, inferior epigastric artery. I think I am clear enough regarding that. I am going quickly so that we cover the first paper. So see on the complete paper. C-section was done, leakage of blood reopened most probably due to uterine artery. Placenta rupture of vessel vasa previa, that is the statement. Teratogenic effect of medicine will be option A is right because 3 to 8 week, that is the right answer. Most common anomaly of premature birth is the PDA, again the right answer. If cloacal membrane failed to open, defect in anterior wall causes, this is called cloacal extropy. If that option is missing, pick the extropy of the bladder, that is the right answer. Metal does not allow the radiation to pass, that is lead. Why? Because the lead absorbs all these rays, and that's why we are wearing the lead in the radiology department. Or a pregnant lady for whom you are going to do chest x-ray, we apply the shield in the abdomen, that is another MCQ. In that shield there is which metal? Lead. Medullary rays, collecting duct, right option. Coming downward, complication of obstructed labor in station 2 scenario, so that is between the bladder and vagina. Option B is right. Turner syndrome is associated with X, not the right option. The key is right. The intraepithelial lesion of vulva, that is the Paget disease, the right answer. Lymphatic drainage of the upper outer quadrant of breast, now that is the apical, and I will share a reference at the end of all these MCQs. Safe motherhood association with B, it is a component of public health measure. Yes, it is related with community medicine. The PPV, that is the positive predictive value, is affected by prevalence of disease. So on community medicine I will make another series of videos. If you want to find out more disease, the answer is sensitivity. More diseased person. So if you are talking about diseased person, sensitivity. If you are talking about more diseased person, sensitivity. Option C is right. True about confidence interval is option C is right. Now I'm not sure about this MCQ. If anyone is having reference, share in the comment below. But on community medicine I will make another series of videos. Meningitis in newborn, that is streptococcal agalactiae, option C, or the second name for it is group B streptococci, I think. Yes, but if they talk about meningitis in newborn in developing countries, then E. coli and listeria, if both are mentioned, pick that. If both are not mentioned, then E. coli. But overall it is streptococcal agalactiae or group B streptococci. If that is not, then E. coli. Or if asked in developed countries, then group B streptococci or streptococcal agalactiae. which is not innervated by pudendal nerve. Posterior fornix of vagina supplied by hypogastric plexus. Wrong about ureter runs over the artery. Now remember mnemonic, water flows under the bridge. Water flows under the bridge. So the ureter runs behind the artery. That I remember. Water flows under the bridge. So coming forward, we are going to finish that today. Which artery does not supply scalp? Again discussed previously. That is a maxillary artery. Turner syndrome is again discussed. Key is right. Down syndrome ratio, that is 1 in 100. Again the key is right. After delivery atrophy of breast, that is because of lysosomal enzyme, hydrolytic enzyme. Triangle of Hasselbeck. Now the indirect inguinal hernia, remember I through inguinal canal, through deep ring. So that is indirect through inguinal canal. Through Hasselbeck, that is direct hernia. Bladder line of trigone is called, that is the answer. Right answer is the Mercius bar. That is actually the mucosa that covers that trigone. The jugular venous pressure, the A wave is produced due to the atrial depolarization. That is the right answer. Regarding that, watch my video cardiac cycle part 1, part 2 and part 3 on my channel. Diagnosed case of appendicitis came with the pain in our IF on the rotation of thigh, inflection of the thigh. Most probable that is pelvic appendix, clear cut case. Now if question says there is tenderness on a very deep palpation, then this is retrocolic or retrocecal or retrocolic if on deep palpation. The interureteric bud is also called mesonephrogenic diverticulum. So the paper first is finished. Thank you for watching.